3-minute daily exercise to improve hardness and natural size. Hello, gentlemen. Have you ever wondered, why was I strong and full of energy when I was young? But the older I get, the weaker I feel, even though I'm not sick at all? Then you see countless ads online claiming penis enlargement pills, magic gels, or stretching devices. But after trying them, nothing really changes. You just end up feeling more tired and anxious. In reality, you don't need any of that. With just 3 minutes a day, you can increase blood flow, improve erection hardness, and maintain your natural male strength, if you understand the medical principle behind it. I'm a urologist, and today I'll explain how a simple, safe, drug-free exercise can completely transform a man's performance. Part 1: Understanding how an erection works. To understand the exercise, we first need to know how the body actually functions. The penis doesn't have bones or large muscles like the arms or legs. But inside it contains 3 spongy tubes, called the corpora cavernosa and corpus spongiosum. When aroused, blood vessels open, blood rushes into these chambers, and is locked in by the pelvic floor muscles contracting. Right pointing arrow creating an erection. If the blood vessels are weak, the blood flow insufficient, or the pelvic muscles are not strong, the blood leaks out early, the erection becomes unstable or soft. So the issue is not the size you were born with, but the health of your blood vessels and pelvic floor muscles, both of which you can train every day. Part 2: Why men after 35 start to weaken. After age 35 to 40, a man's body begins to change. Testosterone gradually decreases each year. Pelvic muscles weaken from long sitting and lack of movement. Blood vessels harden due to cholesterol, stress, smoking, alcohol. Blood flow to the genital area declines. As a result, the little guy no longer reacts as quickly, doesn't stay hard for long, or sometimes gives up halfway. Many think it's just age, but in truth it's because the muscles and vessels are not exercised. Fortunately, with only 3 minutes a day, you can reactivate the entire system. Part 3: The 3 minute exercise. Activate the pelvic floor, Kegel for MEN. This exercise is recommended by the American Urological Association, AUA, and many andrology specialists worldwide. Its name is pelvic floor training, or, in simple terms, the Kegel exercise. Goal: strengthen the group of muscles that control urination and keep blood trapped in the penis during erection. Step 1. Identify the right muscle. Imagine you're urinating and suddenly try to stop the flow midstream. The muscle you just used to hold it is the pelvic floor muscle, pubococcygeus, PC muscle. That's the key group responsible for ejaculation control and erection stability. Remember that feeling, because it's exactly what you'll use in this 3-minute daily exercise. Step 2. The 3 minute daily routine. Total time: 3 minutes. Best time: morning after waking, or at night before bed. Posture: stand, sit, or lie down, as long as your body is relaxed. How to do it? Keycap 1: tighten the pelvic floor muscle, as if stopping urination, hold 5 seconds. Keycap 2: relax 5 seconds. Keycap 3: repeat 10 times right pointing arrow 1 minute total. Right finger after 1 week. Increase gradually. Hold 8 to 10 seconds. Rest 5 seconds. Right finger total about 3 minutes per day. Divided into 2 to 3 small sets. Notes: don't hold your breath. Breathe normally. Tighten only the pelvic muscle, not your abdomen or buttocks. You can do it while working, driving, or watching TV. No one will notice. Step 3. Boost results with a blood flow exercise. Once comfortable with Kegels, add this natural, blood-pumping move. Right finger each morning, when you have a natural erection, or after a warm shower. Gently lift the penis up and down 10 to 15 times. Like a friendly, good morning motion of the body. This stimulates circulation, improves vessel elasticity, and trains the PC muscle to respond better. Just 1 minute every morning, yet visible improvements appear within 2 to 3 weeks. Part 4: Why this exercise can increase size naturally. Many ask me, "Doctor, can this exercise really make it bigger?" The answer: it doesn't lengthen bones or stretch tissue. But it enhances hardness, blood volume, and the full expansion of the erectile chambers. When blood circulation improves, the corpora cavernosa feel completely right, pointing arrow appearing longer, thicker, and firmer when erect. In fact, many patients after 4 weeks of training report easier erections, longer lasting firmness, erect size increase by 5 to 10%, and above all, greater confidence in intimacy. Science calls this penile vascular optimization, optimizing penile blood flow. A small change, yet deeply effective and lasting. Part 5: Supporting factors: water, nutrition, sleep. The 3-minute exercise is the key. But to maximize its effect, combine 3 simple habits. Keycap 1: Stay hydrated. Water keeps blood thinner and flowing smoothly. A dehydrated body means a dry engine, weak performance. Keycap 2: Eat smart. Increase salmon, eggs, leafy greens, avocado, pumpkin seeds, almonds. Reduce alcohol, smoking, fried food, refined sugar. Nutrients like zinc, arginine, and vitamin D boost testosterone and nitric oxide production naturally. Keycap 3: Sleep well and deeply. Sleep is when your body regenerates sex hormones. Just 7 hours of quality sleep can raise testosterone 20 to 30% after 2 weeks. Part 6: Real-life example. One of my patients, 52-year-old James, an office worker, once felt he had lost his manhood. He drank coffee instead of water, sat 10 hours a day, and stressed at night over work. After following the 3-minute exercise and lifestyle adjustments, Day 1 could barely locate the muscle. Day 7 started to feel it clearly. Day 14 could control ejaculation timing. Day 30 felt confident, slept better, felt young again. He said, "I never imagined just a few minutes a day could change so much." My wife noticed before I did. When a man truly understands his body, he doesn't need any miracle pill. Part 7: Important notes. Do not overtrain, 3 minutes a day is enough. Do not hold your breath while tightening, it may cause dizziness. If you feel pain, stop and consult your doctor. Be consistent for 3 to 4 weeks to see clear results. Remember, this is not a fantasy enlargement trick, but a clinically recognized therapy that strengthens natural blood vessels and control muscles. Approved and recommended worldwide. Part 8: Expert's lesson. A man's strength is not in his size, but in his control and confidence. Every day, just 3 minutes. 3 minutes of investment. 3 minutes of reconnection with your body. 3 minutes to reclaim the vitality and energy that age cannot take away. Conclusion and call to action. If this video helps you understand your body better, please like, subscribe, and turn on notifications, so I can continue bringing you practical, safe, science-based insights to help middle-aged men regain performance, confidence, and overall health. And don't forget, just 3 minutes a day. Starting today, your body will change.